Hi everyone, my name is Jessica Rieger, Community Health Educator with Good Shepherd Healthcare System. Today we're going to talk about high blood pressure. So May is High Blood Pressure Education Month, so we're going to give you a few tips to help take little steps in your life to control blood pressure. So first off, normal blood pressure is about 120 over 80 or less. Elevated blood pressure is anywhere from 120 to 130 over 80 or less, and then high blood pressure starts at 130 and above over 80 and above. So there are a few different stages of hypertension or high blood pressure. So talk to your healthcare provider if you have concerns about this. The only way to diagnose high blood pressure is to have your blood pressure taken. Okay, so high blood pressure is what we call a silent killer, because a lot of times there are not symptoms of high blood pressure other than just going and have someone squeeze your arm and take your blood pressure. Okay, so if your blood pressure stays higher than 130 over 80 for a long period of time, any extended period of time, you can have some serious health complications. This can lead to possible stroke, heart disease, kidney disease, even dementia. Okay, so like I said, the only way to know if you have high blood pressure is to actually get your blood pressure taken. So talk to your healthcare provider, see if you need to do anything like that, track your blood pressures if you have issues. So what are some things that put us at greater risk for high blood pressure? The first thing is age. Blood pressure does tend to get higher as we get older, but it can affect younger people as well. So don't just let it go. Make sure you do get your blood pressure checked. Your genes. High blood pressure often runs in family. I know it runs in my family. I have my mom and my dad are both very healthy, but it runs in their family, so they have to get it checked very often, even though they have no symptoms again. Your sex. Before age 60, more men than women have high blood pressure, but after 60, more women than men have it. So that's the breaks. Next up is race or ethnicity. So while anyone can have high blood pressure, African Americans do tend to get it at a younger age. And Hispanic adults or people of Cuban, Puerto Rican, or Dominican backgrounds are also at higher risk. Next up is your lifestyle habits. So we've all heard about this, eating too much salt, drinking too much alcohol. These are things that can raise your blood pressure. So again, talk to your healthcare provider. And we're gonna go through a few tips, little things that you can do in your life to help control your blood pressure. So I'm gonna turn this over to Chris Madrigal and he will be here to help you.
Hi everyone, I'm Chris Madrigal, Health and Wellness Coordinator here at Good Shepherd. I'm going to give you some tips today on how to lower your blood pressure and overall healthy lifestyle. First step you want to take is eat healthy foods. A diet low in sodium and saturated fat can lower your blood pressure and as effectively as medicines. Some tips you can do is add one fruit or vegetable to every meal. Instead of fast food, try salads instead of fries. Give Meatless Monday a try, and commit to one salt-free day a week. Also, you want to move more. Get at least 2.5 hours of physical activity a week to help lower your blood pressure. When you do this 5 days a week for 30 minutes a day, that's very easy to accomplish. So try to implement that in your daily lifestyle. The ways you can do this is invite a colleague for a walk. You can play outside with your kids. Instead of taking an elevator, take the stairs. March in place at your cubicle. Just try to be active, try to move more. Aim for a healthy weight. Losing just 3 to 5% of your weight can improve your blood pressure. If you weigh 200 pounds, that's a weight loss of 6 to 10 pounds. Join a weight loss club with a buddy is a good way to start this. You can also look for social support through social media or through your coworkers or your family members as well. Also, manage stress. Stress can contribute to high blood pressure and other heart risks. If it goes for a long time, it can make your body store more fat. The thing to do to lower stress is to practice mindful meditation, share a funny video, joke, or inspirational quote with a friend. Also talk with your doctor if you have trouble managing your stress on your own. And the final tip is to stop smoking. The chemicals of tobacco smoke can harm your heart and blood vessels. Quitting is hard, but many people have done it, and you can too. Go to smokefree.gov, also sign up for a support group, or join a local sewing, knitting, or woodworking group. Try to get your mind off of smoking and try to focus that energy on other more productive habits. From all of us at Good Shepherd, stay safe and stay healthy.
And we're all in this together.